The adaptation of treatment according to the results of early PET in diffuse large B-cell lymphoma is an important question for the LYSA. We recently published in Blood a PET-adapted strategy in young patients with poor prognostic factors, where the consolidation phase was guided by the results of the interim PET. Here, in the study presented at ICML meeting by Serge Bologna, things are very different. The population included diffuse large B-cell lymphoma patients without any poor prognostic factor according to the IPI. Therefore, they had a localized disease with normal LDH level and a good performance status. But they could have a bulky disease, and they were aged up to 80 years. The question of this randomized open phase 3 trial was whether a strategy of reduction of treatment intensity as guided by early PET was equivalent to the standard treatment with 6 cycles of R-CHOP in this population. In the experimental arm, patients who had negative PET after 2 cycles only received a total of 4 cycles of R-CHOP. PFS was the primary endpoint, and 2 important points must be underlined. First, there was a thorough review of PET-CT to guide the decision of the investigator according to the assessment of Deauville scale. And this review was effectively conducted in 97% of the patients. Second, these patients with a localized disease were not scheduled for radiation therapy. 650 patients were enrolled, and the median follow-up was 5 years. The major findings are: the first, the study met its primary endpoint. This adapted PET strategy is not inferior as compared to the standard treatment in this population. 80% of patients had a negative PET after 2 cycles of R-CHOP. Their PFS at 3 years was 92%, similar for those receiving 4 cycles and those receiving 6 cycles in the standard arm. About 10% of patients had a positive PET after 2 cycles, but had a negative PET after 4 cycles. They received 6 cycles of R-CHOP, and their PFS at 3 years was 88%. A fraction of 10% of patients had still a positive PET at 4 cycles. Their PFS was clearly shorter, and a different treatment should be considered in this patient at this point. Several analyses from this study are still underway, but this PET-guided strategy is now widely adopted in routine for this population in the LYSA centers.